Hello everyone. In this highlighting shorts, I am going to tell you about tissue remodeling and how it is associated with the pediatric lesion called as Acrodermatitis enteropathica. So this is a beautiful correlation between pathology and the clinical subject like a pediatrics or dermatology. So what happens in tissue remodeling? It is a granulation tissue to scar formation. Remember, granulation tissue to scar formation is called as tissue remodeling. So what happens here in granulation tissue, abundant collagen is type 3 collagen, right? So this type 3 collagen will be degraded by enzyme called as matrix metalloproteases. They will degrade collagen 3 and they will convert them into scar formation where collagen 1 will become dominant collagen, right? So this granulation tissue to scar conversion done by matrix metalloprotease is known as tissue remodeling, right? So as you can see, the name itself is telling matrix metalloprotease. So protease will digest the matrix protein, which is collagen here, and in this process one metal is very important cofactor. So what is that metal which is most important cofactor for this enzyme? So that metal is zinc. So what zinc will do? Zinc will help in stabilization of this matrix metalloprotease. So that is why if there is, so you can understand why we are saying zinc is very essential for wound healing, because it helps in tissue remodeling by giving the good activity to the matrix metalloproteases. But when they are deficient, what will happen? Child will be having lesion like this. They are having rashes all over body and the extremities, and this baby will be having diarrhea also. So this condition is called as Acrodermatitis enteropathica. So zinc is very essential for cutaneous wound healing, and when zinc is deficient, patient may have disorder like Acrodermatitis enteropathica, where you will see the rashes all over body and they will be having diarrhea, right? And apart from that, zinc is also very important for stabilization of insulin, right? And that is why zinc is added in many of the insulin injections also, or insulin medications also, so that it can stabilize the insulin. So this is the proper correlation. So tissue remodeling where zinc is essential, and because of zinc deficiency, cutaneous wound healing will be defective and patient may develop acrodermatitis enteropathica.